Hi, my name is Michelle Candela.
And I'm Julia Young. And our first idea that we have been discussing has to do with ER onboarding. So it would be a mobile ordering service for the ER. So essentially the specific problem we are addressing would be long wait times and going to the ER when it's unnecessary. So this service, which I think we've talked about, and it's going to be a website, like an online form, will give you a spot in line before you even leave your home. It will notify you of the expected wait time, and you can also input why you are coming to the ER. So maybe some of your symptoms, or if you have any chronic illnesses or anything like that. And it also will provide you with a quiz regarding if you should go to the ER or an urgent care or minute clinic, depending on what your symptoms are. So currently, you cannot check into the ER before physically arriving to the ER. Like right now, I researched that. So with this application, the check-in and triage, based on the severity of the condition that you have, can occur before coming in. So essentially, less people will be flowing into the ER at once if they already have a spot in line, have already registered, and do not have to leave their homes until it is closer to their appointment time. The quiz determining the ER versus an urgent care can divert unnecessary patients from coming into the ER for illnesses or conditions that can be treated elsewhere. So say you have a sore throat and you think you need to go to the ER because you think it's really severe, but really you can go to an urgent care because it might be strep throat and they can test it there. So this will also help with the flow and lower the influx of patients that come into the ER. So our target market is going to be big hospitals, ERs, across the country. More specifically, we're targeting individuals with chronic illnesses who are frequently visiting the ER to use this application. So we estimate it's going to be about 50 to 60 million individuals across the country, based on in 2021 there was about 139.8 million ER visits reported from adults, and about 50 to 60% of those were patients with chronic illnesses. So, yeah.
The second idea I'd like to present to you talks about non-invasive glucose monitoring using infrared light systems. So similar to a pulse oximeter reading or monitor that you just clip on your finger, it uses infrared light to detect the amount of oxygen in the blood. So our idea would kind of be similar to that, but just focusing on blood glucose contents. The specific problem that we're addressing with this is non-compliance with diabetes regimen. A lot of people don't like pricking their fingers. It's, for one, painful. Two, you're having to buy a lancet, so you're having to buy glucose strips, you're having to buy a glucometer. Some people even go as far to buy a Dexcom, and sometimes insurance doesn't cover all of this. So the buildup of supplies can become really expensive and taxing on the client. This also goes into bucket 1 and also bucket 2, because with discharge teaching, we want to be teaching our clients to monitor their glucose. Having that tight glycemic control really helps prevent complications, and those complications can cause them to be in the ER, talking about what Julia is discussing. This is resolving our problem because clients are going to be more inclined to test their blood sugar if they're not enduring any pain during it, such as when they're poking their fingers. And also, it's not as expensive in the long run because you're only having that one upfront cost of buying the, similar to a pulse oximeter. This is uniquely superior because all other monitoring like Dexcoms, glucometers are expensive or painful. Even though the Dexcom is not painful throughout its stay on your arm or is your body, it's very expensive, and using a lancet each time you want to test your blood sugar is extremely painful. And in my own experience, I've seen lots of clients who don't test their blood sugar for that own reason. And our target is going to be specifically with type 1 and type 2 diabetic clients, because these are going to be the people who are mainly checking their blood sugar and wanting to maintain that tight glycemic control. And the CDC said that in 2019, 29.7 million people in the US were diagnosed with diabetes, and that's almost 9% of our population. So it's certainly a large market, and it's one of the most debilitating chronic diseases in the US. So thank you.
All right. Well done.